Assalamu alaikum everybody. Our today's class is on low birth weight. Learning objectives for today's class are definition and grading of low birth weight, types of low birth weight, causes of low birth weight, care of low birth weight babies, prevention of low birth weight, and at the end MCQs that will test the knowledge of students. A brief introduction to the birth weight and its importance. What is birth weight? First weight of fetus or newborn obtained after birth is birth weight. Birth weight is the single most important determinant for the survival, growth, and development of the infant. It reflects the health status of mother during adolescence and pregnancy, and also the quality of antenatal care that she has received during these months. Definition of low birth weight. It is defined by the WHO, World Health Organization, as weight at birth of less than 2.5 kg within 1 hour of birth, irrespective of the gestation age. Now the problem statement. The global prevalence of low birth weight is about 15.5%, which amounts to about 20 million low birth weight infants born each year. More than 96% of them in developed countries. As per WHO criteria, the incidence of low birth weight in India is 33% each year. Grading. Low birth weight grading. There are 3 grades of low birth weight. Number 1. If the weight of baby lies between 2500 grams and 2000 grams, we call it low birth weight. And if it lies between 2000 and 1000 grams, we call it very low birth weight. And if it is less than 1000 grams, it is extremely low birth weight. Now the types of low birth weight is based on the origin. It can be either preterm or small date, which we also call the intrauterine growth restriction. Now the preterm. These are the babies who are born less than 37 completed weeks of gestation, and this accounts for 1/3 of the total low birth weight. And IUGR is a newborn which is smaller and lighter than what it should have been for that pregnancy period due to failure in the intrauterine growth, and this accounts for 2/3 of the total low birth weight. What causes low birth weight? Or we can see the causes of low birth weight. In nearly 50% of cases of low birth weight, the cause is not known. In remaining 50% of the cases, causes are grouped into medical and social causes. Medical causes can be maternal causes, like all high-risk mothers except diabetes can cause low birth weight. Placental causes can be placenta previa, congenital defects of placenta, and fetal causes like multiple gestation, hypothermia, or intrauterine infection. These are the medical causes of low birth weight. Social causes are poverty, illiteracy, ignorance, smoking, lack of knowledge on family planning, poor standard of living, or early marriage. Now the signs and symptoms of low birth weight baby. They usually are small in size with a disproportionately large back. Sharper look. They look sharper, like less bulgy, less rounded features than a full-term baby. That is due to the lack of fat storage. Fine hair covering much of the body, which we call it lanugo. Symptoms can be also low body temperature, especially immediately after the birth, in delivery room, due to lack of body fat. Now the problems of low birth weight, preterm baby. Problems can arise during birth or after that, like birth asphyxia, feeding difficulties, infection, appendicitis, hyperbilirubinemia, hypothermia, retinopathy of prematurity, respiratory distresses, metabolic acidosis, or intraventricular hemorrhage. These are the main problems which preterm babies face during or after birth. Likewise, problems of small parted or unusual babies. During birth, there can be birth asphyxia or meconium aspiration syndrome, and after birth, there can be hypothermia, hypoglycemia, infection, or polycythemia. Now the care of low birth weight babies. As we know, the death rate of low birth weight babies is very high. With simple care, we can support and advise the family how to care for these low birth weight babies and improve greatly their chances of survival. Their management depends mainly upon their birth weight. If the babies are born with a birth weight of 2500 grams or 2000 grams, they require special care at home. Simple. If the babies are born less than 2000 grams, they require intensive care at hospital. But if the babies born are less than 2000 grams and more than 800 grams and are hemodynamically stable, they require Kangaroo mother care. I will be discussing these one by one. Now, what is special care at home? Special care at home works on three principles: prevention of infections, hypothermia, and correction of malnutrition. First, how to prevent infection. Gentle and minimal handling of these babies. Handling with clean hands. Room must be warm, clean, and dusty. And immunization at right time. By these means, we can prevent the infection of the baby. Second, prevention of hypothermia. First, we should avoid bath till the baby attains weight of 2500 grams of weight. Cover the baby with clean, dry, and warm clothes. Bottles filled with warm water and covered with thin cloth are kept on both sides. third is correction of malnutrition. As you know, these low birth weight babies cannot suck milk actively. They get tired faster. So frequent breastfeeding must be given almost every alternate hour. This table shows the birth weight in first column and room temperature in the second column. As we can see, the set temperature depends on the birth weight of these babies. Now the special care at hospital, or we can say the intensive care at hospital. First is prevention of infection, that is prophylactic antibiotics to prevent the septicemia, separate nurses for feeding and toilet attendance, and third is barrier nursing to prevent the cross infection. Prevention of hypothermia. Child is put under incubator which maintains the temperature, humidity and oxygen supply till weight increases to 2000 grams. But the oxygen supply is very important. There should be careful monitoring of the oxygen supply because the low oxygen levels can cause hypoxia and cerebral palsy, whereas high oxygen causes retinopathy prematurely. Correction of malnutrition. Tube feeding is done because the baby is in incubator and is too young to suck mother's milk. Now the Kangaroo mother care. Kangaroo mother care is given to those babies who are hemodynamically stable and whose weight is more than 1800 grams and less than 2000 grams. It has three main components. Number one, continuous skin to skin contact between the baby's hand and mother's chest. It starts at birth and is continued day and night. There may be brief interruptions such as when the baby is being bathed. The baby wears only a hat or cloth to keep the head warm and the neck. Second is exclusive breastfeeding. The baby breastfeeds within 1 hour after birth and then every 2 to 3 hours. The baby is unlikely to be able to suck the breast properly, so we will need to support the mother to excess milk so that she can also feed the baby. Number 4 is support the mother. The mother can continue to do what she normally does while providing Kangaroo mother. For example, cooking, cleaning, and cooking. However, she needs support from her family members and others in the community by keeping the baby sitting for short periods while the mother rests or takes care of other things. Prevention of low birth weight babies. How we will prevent this problem? Prevention of preterm birth is one of the best ways to prevent babies born with low birth weight. Prenatal care is a key factor in preventing preterm birth and thus low birth weight babies. At prenatal visits, the health of both mother and fetus can be checked because maternal nutrition and weight gain are linked with fetal weight gain and birth weight. Eating a healthy diet and gaining the proper amount of weight in pregnancy are essential. Also, mothers should avoid alcohol, weed, smoking, and in illicit drugs which can contribute to poor fetal weight. Now the multiple choice question here. Now kindly go through these MCQs and test your knowledge. Here is the answer to these questions. Thank you for watching.